Welcome to my Zoom meeting.
Hey, Carol.
Hey, Rick, how are you?
Well.
All right.
Doing well. Like your slides.
Yeah.
I do not know why.
Have you seen them?
I looked at them this morning.
Okay. I added what you wanted me to add, so we're good.
Great. Yeah, look good.
I guess we should wait a little bit, huh, Tracy?
Wouldn't hurt to wait like a minute or two. Sometimes you have people jump in late.
Okay. That's fine.
Tracy, thanks for that last minute email.
Oh, no problem. Who am I talking to?
Andy Myers.
Oh, hi.
Did you survive the football game, Andy?
The disappointment wore off eventually. At least
That
Penn
was-
State won the same day.
Oh. Yeah, that was frustrating, but
Yeah, well,
Ready whenever you are.
all right. We'll go ahead and get started, and I appreciate everyone that's here and probably will be coming in. So we're gonna just kind of go with the flow, basically. I have this very loosely kind of organized because that's how I kind of teach. But we're just going to go ahead, and I want to do some introductions real quick, and based on the contributors on the PowerPoint slide. I'm not sure if Anthony is here yet, but Anthony Norris, who is with the YMCA, will be with us. The great inglorious Daphne McFerrin. She's around here somewhere, right, Daphne?
Yes.
All right. Jennifer Taylor.
Hello.
Hello. Who is the manager now for injury prevention and Safe Kids at Le Bonheur. For some of you that don't know this, I guess I should also be like Andy Myers is professor emeritus in the Department of Psychology. And he should have been professor emeritus a long time ago. He's really good.
I'm happy to be as old as I am only now. So,
You are not that old.
God.
Well, and then I just saw also Richard Irwin pop up. He finally put his face on. And he happens to be related to me. We are married. And you're going to learn later on, if nothing to do with Make a Splash or any of the USA Swimming could have been done without him. So we'll put that story together as well. We have got, is Susan here yet? Susan Helms?
I'm here. I don't know
Thanks.
why my picture's not showing, but I'm here. It's the heart.
Susan Helms was the former manager, injury prevention person, Safe Kids person at Le Bonheur. And you still get to do a lot of work, don't you? So we appreciate that. And we've also got Jamie Brunston. And are you around, Jamie? And anyways, if he might have popped out, or there he is. And he's brand new assistant professor in our area in physical education teacher ed. And he has a story to tell about his experience with a free or low cost swimming team and program as well in Tuscaloosa. And let me see, Deborah Wyatt is a former grad student, a former GA, and she did her master's degree applied project based on the same issue, trying to get kids to learn how to swim. And she's got some good stories about college kids not knowing how to swim and how to overcome that. And let me see, Gabrielle, you're around somewhere.
Hello.
Hello. Gabrielle is the executive director for the Rose Foundation, and she's a former Olympian, former Olympic swimmer. What was your event?
200 individual medley. So I swam in that in Sydney in 2000.
Wow, that is amazing. And she's also, more importantly, a former Memphis Tiger swimmer too. So she was grown in Memphis and ended up in the Olympics. So, and she's, we're all connected kind of, and we all kind of have this story. And did I forget anybody?
Rick Bloomer.
Oh, well, Rick Bloomer, he's my boss. So I have to have him on. But he's a very, very good dean of our college and very supportive. And he's involved with the natatorium, which we're going to talk about as well. So, so we're just going to go ahead and get started if everyone's okay. Okay. First of all, some quick drowning facts, and I promised Andy that there would be few statistics, so not too many, but just to understand that drowning is kind of like a silent, cause of death in a lot of different ways, but not very many people really understand how bad it is, what a important issue it is for especially children ages 1 to 4, and they die from drowning more than any other cause of death except birth defects. And also children 1 to 14, drowning is the second leading cause of unintentional injury death after motor vehicle crashes. So every year in the United States, about 4,000 fatal unintentional drownings, which means about 11 per day, about 8,000 non-fatal drownings, which is you did drown and you made it to the hospital in time and have been revived, basically. Some with very few injuries or further issues requiring hospitalization, and some not. More than 40% of those non-fatal drownings that make it to emergency departments require further hospitalization. So that ends up being not only drastically bad to their welfare, but then also just money, it costs. So drowning disparities, where there are some huge drowning disparities are children, especially ages 1 to 4. Males drown at a very high rate. About 80% of all drownings are males. Certain medical conditions, that's also a disparity with drowning. And then obviously some racial and ethnic groups too, which is what the research was all about. Oops, sorry, where am I? Okay, here's some quick and fast research statistics from our USA Swimming research that we did. And we actually did it in 2008, 2010, and 2017. The 2008 study was almost kind of like a pilot study to get the methodology right and to get the survey right. But in 2010, we found that males have no or low swimming ability at a much lower rate than females do. So females have, I don't know, maybe females were more honest about it as compared to males when they had to identify their swimming ability. But this kind of plays out in other research too. So even though males have a higher ability to swim, they end up drowning more than females. Also, the no low swim ability with race ethnicity. We found that 68.9% of our respondents indicated they had no or low swimming ability. And these were our African-American Black respondents. And these racial identifiers were the ones we used in 2010 and 2017 because they were the ones that the CDC used at that time. So I'm trying to be as accurate as possible. But that nearly 70% of Black respondents compared to 42% white. And then Hispanic Latino respondents, there was about 58% that had no or low swimming ability. So there's a definite disparity there, and it played out about the same with our respondents in 2017 as well. And then we've also got household income, which matches very well with the racial differences. And if you had free lunch or even reduced lunch, you had a much higher no or low swimming ability as compared to no lunch program. This was a income indicator that a lot of people have used in the past. And I think reduced lunch was about $40,000 or $45,000 a year or lower. So household income is an issue as well. And again, it kind of played out in 2017 to be just about the same, really, overall. Okay, so what we're going to do is we're going to start talking about the Memphis story. And this is where other people can start to chime in. And the Memphis story kind of began back in May 31st, 2008, opening day for outdoor pools in Memphis. 2 African-American adolescent boys drowned within hours of each other, different city of Memphis outdoor pools. And I don't know, Gabrielle, were you around during that time? Or were
No,
you?
I wasn't, but Susan and Anthony definitely were sparked and moved by those tragic events.
Susan, why don't you go ahead and jump in and kind of describe what was going on at that point?
I think I would say that, of course, the community was upset, and some of us were really outraged by it and really wanted to make sure that this didn't happen again. And so it seemed like a perfect opportunity to have a rally cry for us to gather anybody interested in making this not happen again, meet. And that's exactly what we did. We sent out a letter not knowing who would come, and we really had a good turnout of about 35 people representing aquatic centers, safety organizations, or interested citizens. And we met at the American Red Cross and basically just started the conversation with what is the issue. And I remember placing on the whiteboard just what everyone was saying. And we put up about 100 things, and some of them were similar. So then we narrowed that down into what were likable things. And then we narrowed it down even further into things that we thought that were doable to address. And that's how we came up with an idea that we needed to focus on free or low-cost swim lessons for at-risk minority participation for sure. Wanted to enhance lifeguard training and wanted to promote and engage everyone in water safety lessons, especially community CPR. And from there, we decided that this group would continue meeting and figure out how we would do that. And it was kind of the beginning.
Right. Okay, so, and I wasn't really a part of that group.
At first day, yeah.
Yeah, I had no idea. We had no idea what was going on because we were busy going to different cities and doing survey work. Basically, at that point in time, we did not do any focus groups. So actually, my husband, Dick Irwin, is the one who got the grant basically because through USA Swimming, and assembled a bunch of professors together. And I was interested because I used to be a lifeguard and swimmer myself. So anyways, we were busy with doing the national research, but in the community, very much like you said, Susan, everyone was shocked and outraged, and lawsuits were filed. City leaders closed pools. They retrained lifeguards and pool managers, and they put more restrictive policies in place, like pool cards, right?
Right, absolutely.
Okay. And this top-down approach was needed, I guess, to retrain the lifeguards and all that. But the more restrictive policies created a problem with trying to get kids to learn how to swim. So there was some issues there. And then the task force that was at the American Red Cross was kind of our bottom-up response to that. And there was all kinds of different agencies. It included, and I'm not sure if Anthony was involved at that point.
He
Susan,
was, he
Was
was.
it? He was, okay.
I would describe Anthony at that time and continuing as the champion that we needed. He was the parent of, at that time, 2 young swimmers, which I think are now in college, but recognizing the importance of participating in a sport that was often overlooked because of cultural differences. And with his time and expertise with that, that's helped us move forward.
Right. So Anthony, and I think he just checked in, Anthony was, like you said, was kind of like the champion for this group. And he was not only, you know, this very important part of the community, but he was a swim dad, very much like Andy Myers was a swim dad. And we all know, all of us who've had children, you end up sitting around, waiting around for swim meets or swim, you know, specific races. And so there's nothing else to do except talk to each other. So, so Andy and Anthony, why don't you guys go ahead and talk about, you know, what came up with your conversations in the bleachers?
Sure. First of all, just so excited to be here. So on that weekend, Memorial Day weekend, I had I had 2 young swimmers. My daughter Kiara was 7, and Jordan was 5. And they both were on the Memphis Tigers swim team. And we attended in Orlando, Florida, the National Black Heritage Championship swim meet, which was just such an eye opener to see hundreds of children of color swimming at all types of levels and in a fun and exciting meet, while we were one of just a handful of families of color on the Memphis Tigers swim team, and mostly one of very few families of color at swim meets. So that was an exciting moment in time. And it was that weekend when your article came out. And that was the talk of the swim meet, because USA Swimming, their diversity chair was there and talked about that revelation that was covered in USA Swimming. I mean, not USA Today, and made national attention by a research study done at the University of Memphis. And that weekend we returned was when those 2 teenagers drowned. And so to have all of those things happening at the same time was what was providential and kind of a call to action for me. There were swim parents who were also leaders within the university and the swim community, Bisha Harrington being one. She had a daughter that was swimming at the national level, as well as Andy Myers and Jim Whalen that were swim parents, and took me under their wing as far as the sport of competitive swimming. But I was just fortunate enough to be invited to that initial task force meeting. And I was served on the board of the Fogelman YMCA advisory board, where they had started a Swim for Life program, as well as the Downtown Elementary Water Safety Program. So I was familiar with those initiatives at one particular pool. And then as a parent, and also then soon thereafter became a board member with Memphis Tigers Swimming, was just, I think, very, very fortuitous to be part of. But it was really Susan that called the community together, that but for that galvanizing, I don't think Splash Mid-South, or Make a Splash Mid-South as it was called shortly thereafter, would have happened. But it was that fateful moment, and then it became a mission. So it was really blessed to be part of it, and so excited to see the results, but then also even more excited about what the future holds. So then fast forward, my 2 children, Kiara, who was a 7-year-old then, is now the co-captain senior swimmer at Fordham University this year. And Jordan, the pandemic kind of killed his senior year in swimming, so he decided not to swim in college, but he is a freshman at Middle Tennessee State. University, and they grew up with Splash Mid-South.
Yeah. Yeah, I just, I loved the one comment that when I interviewed Andy about how you two were talking in the bleachers about it. And then Andy, you basically said, we need to get you guys together.
Yeah,
Right.
it was this issue, I think, that really put Anthony and his family and our family together. And, there was just this sense that we had to respond in some way to it. And then Lee, who was an executive at Methodist Labanner at the time, started talking to us about Susan and her work. And it just became, a vital practice for us to do something that would involve both the swim club and ties to some of the other organizations in the community that were responding to the unfortunate deaths. And I think at that point, both Anthony and I eventually were on the board at Memphis Tiger Swimming, and it just became a part of Memphis Tiger Swimming to respond in a productive way to this important issue.
And Andy also connected, really, as you mentioned, Carol, to the research and the discipline. And one of the first introductions, he said, you need to meet Daphne McFerrin, as well as Carla Peter Ryan. They said, you need to meet Daphne. And that meeting really was transformative too, because we were planning our first I Have a Dream swim clinic. And so we were seeking financial support to help support the free swim lessons and this event. And Daphne said, yeah, I could, help with funding, but what you really need is you need to study the work that you're doing. You need to document and track it from the very beginning. And she was, couldn't have been more true, because that's really where we became engaged with the local research that was connected to, obviously, the national research studies that you did.
Great. I'm going to jump just ahead in regards to, we had just concluded just exactly what you said, and then major findings, were coming out from that. And then what we ended up doing was bringing the university and the task force together, thanks to Daphne. And Daphne, I will always remember you talking about how important the research was. And I appreciated that, because that helped guide the program.
Yeah. When I met Anthony, it became, I think within the first, I met him with Andy, who brought him to my office. It became apparent in the first 15 minutes that this had really broad implications. And Anthony, rightly so, when you're in the trenches, you're thinking about how to make ends meet and how to meet your financial responsibilities as they arise. And I played the role of having the luxury of saying this has greater potential. And Anthony and you, Carol, and Richard embraced that and connected with Anthony and the program and the mission and the importance of it. And I think through the research brought Splash Mid-South in sort of closer alignment with where the university could go with it in terms of a catalyst for community uplift. And I am very proud of the past history and the accomplishments of this team. However, I am looking forward more to what's going to happen now since the natatorium has been approved, because I think it's an opportunity, it is an opportunity to engage with the community at a larger level. It's going to take a lot of work and commitment from people, both at the university and in the community. In addition to offering swimming lessons, it will be an opportunity to bring the greater community of Memphis, especially the African-American community, closer to the work of the university. And there's often a disconnect between that. And so, yes, absolutely, it's important. And that's why we're here, to make sure that minority youth and all youth have opportunities to become proficient in swimming. But I also think a lot of goodwill in terms of advancing the university's educational mission, repairing some of the historical issues between the university and the community can take place with the success of the natatorium and swimming lessons for the greater Memphis community.
Yeah. And it was always so great to have some extra funding to help fund the research, the local research, because there were so many other sponsors that came on because of that aspect. We were researching it. We wanted it to be a good program, not just we're going to throw out this idea and that idea and see if it sticks. So I really appreciated your leadership in that regard to kind of make us all aware of how important that was. So
you and Richard were easy to work with, and I'm very proud of the monograph, which is on Amazon. And I think the first monograph we produced, Hooks distributed that nationally just by finding YMCAs and mailing it to them. So this is great work, and people should know about it. So we should take every advantage to promote it, because now, of course, it demonstrates the commitment of the team, but also it's an opportunity to educate and encourage people nationally and other communities to address this issue the way we have.
Very good. So this university task force, connected everybody, and we started the pilot study, and here's the group that started out all smiling and happy and ready to jump in the pool. And then the pilot and first year results were all very, very positive. I mean, swimming, there was only 12 swimmers and 8 completed, but we still measured what they did, and they went, 5 of them were at risk, and there was, quite a few that got out of that at risk and actually jumped a couple spots up to more proficient swimmer. They answered water safety questions correctly. They had great attitudes, very positively improved pre versus post program. And the qualitative results, we did focus groups with the kids and the parents, and the instructors and everybody else, the program developers. And it was quite a learning experience for this professor. So it was actually a lot of fun. And then that was it. We were off to the full year program. And at that point in time, there was more than 150 swimmers. Swimmability was 100% improvement. Everybody improved at least one level. And that was American Red Cross. So 24% improved just to level 2, but more than 67% improved to all the way to level 3. So, these kids were like, little fish in the water. It was hilarious watching them. And the qualitative results reflected the pilot program too. So it was a success. And again, showing that in the research was very powerful. So we formed our solution. I know we called it Make a Splash Mid-South for a little while, but it's Splash Mid-South now, and it has been continuing since 2008. And approximately over 7,000 children. Is that right, Anthony?
Yes, a little dated, but it's more than that, but yes.
Yeah. And then they become water wise. They learned how to swim, have the opportunity to swim competitively. I've often said, if kids don't learn how to swim, they will never be on a team, and they may never get a college scholarship. So kids that don't learn how to swim also then probably will never have a job in the aquatics industry. So there's so many repercussions for not learning how to swim. So besides drowning, obviously, but there's other things too that are lifelong. And but besides learning how to swim, lifeguards, lots of enhanced training there, and many adults were CPR trained, right, Susan?
Right, about 1,250 to date.
Wow, that's great. So my husband, Richard Irwin, and I sat down and we thought, okay, we've got to figure out what makes a great local free or low-cost swim program. And we came up with what we did, of course: assemble a passionate task force, set a realistic budget, adhere to a developmentally appropriate program structure, ongoing evaluation and feedback, and informing the community. So, each one of these, this is what our passionate task force was. U of M research members, Memphis Tigers parents, swimming parents, program developers, City of Memphis government. I mean, we had to get city pools a lot of time. And not only City of Memphis pools, but then also aquatic directors from the YMCA. U of M organizations like the Ben Hooks Institute for Social Change, as well as the Pete Majors Club. There was all kinds of little things like that. Nurses were involved. There was the Student Nurse Club was involved. Lots of health and safety advocates like Susan and Le Bonheur Children's Hospital, as well as just our U of M pool facility and the staff involved around that. And I end up helping a lot of programs because they'll call and say, tell us what we need to do. And I always give them this formula, which was our formula. But I also really highly suggest they get the Children's Hospital involved, because that's where the kids who drown go. And they're very passionate. Le Bonheur was always so great to work with, and I do appreciate that. The second one, budget, you have to figure that out, where the money comes from. And like Ben Hooks did a great job of covering a lot of the initial costs as well as the research. So City of Memphis included the sliding scale fees as well as the YMCA. They lowered fees for families that qualified, and then grants as well as other donors have been in and out of giving the program money. Learn to swim program structure. You should have all of these put together, and something for kids to look forward to as well as parents. Evaluation, definitely keep track of the numbers as well as how they improve, pre and post lessons, to kind of show that that's our shining moment right there. And then also informing the community. Done a lot of interviews with the news stations. I think Anthony, you've been on TV a couple of times. Susan's been on TV a couple of times, radio, wherever you can tell people how important this is. So also, besides the swimming lessons and research workshops for swim instructors, we haven't had for a while a diversity swim clinic or meet, right? I can't remember when the last one was.
But we're planning some new ones.
Yes,
That's
we've had clinics
Right.
throughout, and even during the pandemic or coming out of the pandemic.
Yeah, that dang virus. And then the developmental swim team, and that's still ongoing as well, isn't it?
Yes.
Yes.
So they don't jump into with the Memphis Tigers right away, swim team. They learn about, starts and flip turns and all the other things that they need to know about being on a swim team.
Can I speak to that, Carol?
Sure.
Well, one about the pilot program, I really would love to mention an unsung hero who is near and dear to our heart, but Coach Cynthia Dickerson. When we first started the program, we had this great plan, all those key components of the task force, but we didn't have swimmers. We didn't have participants. We didn't have children. And so we started the pilot in February and said, all right, let's go get children. And could not get, we went to
Well, and it was mainly because parents were scared, right? They
Yes.
didn't want to have their children in the pool.
And then the cold.
Winter.
And then they were scared about getting their hair wet in
Yeah.
the winter. And it was Coach Cynthia, who was a swim parent and former coach. She started the swim team at Central High School, when her son, who went to swim at Howard, wanted to swim in high school, but they didn't have a swim team. So she had a daycare, and she got children that were in her daycare program and brought them to Bickford so that we could have that pilot program. And then to your point about the developmental swim team, would love to say that was the plan from the beginning, but it really was participants in the first swim lessons program go to one of the existing swim teams. And that was a rude awakening. That was you talking about learning to swim into the deep end and swimming with peers that had years and years of competitive swimming experience. And that's when that's a wake-up call, because it was just too much too soon. And then Coach Hahn at the city of Memphis at Hickory Hill had an opening, and then Coach TR, whose brother swam in the Olympics, said, I would love to get involved. I said, hey, let's start a developmental swim team so that the children that came out of our swim lessons program had a friendly developmental skill level where they could learn the real fundamentals and then graduate to a more advanced competitive swim team.
Yes, I think we really had big ideas, but we all worked together to really launch this, and it kind of became a child to us, and we watched it grow, and it was a lot of fun. So anyways, this is what we have now is we have Splash Mid-South, and they continue to use the website to sign up for swim lessons. And also what I want, I brought a brand new professor on board to this healthy conversation because he helped with a program very much like ours in Tuscaloosa. And so Jamie, I want you to kind of talk a little bit about your experience with swimming and with your program.
Of course. So firstly, thank you very much for colleagues inviting me to share a space and to chat with you about this topic. There's a few things I wanted to talk about, but I'll begin with the program. I was very fortunate enough to, when I was completing my PhD at the University of Alabama, there was this Swim to the Top program. And I was confused initially because in the UK, after school programs or summer programs for swimming really aren't a thing. And maybe Carol's talked about this previously, but at least in my school experience, it's policy, it's in the legal documents that all children in years 3 and 4 get 2 hours of swimming every week.
This is in England, right? This is in England.
Yeah. Mm-hmm. And so for me, my experiences with after school programs or summer programs for swimming, it was really interesting to me. And the more I was working with these programs, the more I was beginning to understand that there was a genuine reason and an issue surrounding swimming education. And so more specifically with this program, it wasn't a exclusive swimming education program. There was a life skills, civics education component. There was a swimming education component. There was the physical education component. And so kind of dissimilar to the program at Memphis, it had a broader or a different lens to attack this issue. And one of the ways in which they actually hooked a lot of these underserved children was that they weren't just getting swimming education. They were getting civics education that was going to help prepare them to go on to high school or middle school or college. But they were also getting physical education and that quality teaching. But if I can take it back to just some of the things I want to talk about on the slide, education is a human right. It's an established human right. And so now, I'm pretty sure we're all arguing for the same thing, that swimming education should also be a part of that human right. And based on the statistics we've already seen, it's especially important with minorities and specialist populations. And so I was very fortunate enough where I have been lucky to work with groups and have my own swimming education in ways which allow me to help shift this narrative and to work with communities at Memphis. And so I was going to say, could you go to the next slide, please,
Sure.
Carol? And so not to kind of, again, bombard you with statistics, but when I was doing my own research on this, it was, nearly 600 deaths over the span of 10 years related to swimming. And it's shocking. It shouldn't be happening. And I think if we can provide some sort of statutory required swimming education, not only will it benefit these kids, but it'll also help kind of those children then educating their parents or becoming more comfortable being around water in general. But I've got a few more things, but I mean, that's all.
Okay. And Jamie's being a part of this is kind of interesting to me because I've always used the statistic of the overall rate of drowning deaths in the UK is 0.06, I think, or anyways. And then the rate here in the United States is like 1.4, 1.5. But this is something that recently I just found today. Oh, whoops. We're going to come back to you, Deborah. Oops, it's not on here. That since the last 2 decades, drowning has dropped drastically, like 38% from what it used to be. So I think things are getting better. And our rate is actually at 1.0 rather than 1.6. So we're actually working towards, trying to get through, the drowning issue. I think USA Swimming has done a great job of taking the data that we've gathered and blasting it out to everybody. And I think there's been a lot of programs, very much like Splash Mid-South, that have formed across the country too. So I think that's dropping the drowning rate as well. So there's good news, I think. And I appreciate USA Swimming's, really help and focus in on the research so that they have accurate numbers. So now, Deborah, I was going to ask you to talk a little bit. One thing about this program too that has another caveat that is so wonderful is that many of my students have done research and have done the research on the program. But Deborah is a former graduate student, and she is now the coordinator for physical activity courses at the University of Memphis, which includes swimming. But Deborah, go ahead and talk a little bit about your experience with the research.
Yes. Well, when I was in undergrad, I took WSI and lifeguarding, all those classes, and really started getting an interest in teaching swimming and all that lifeguarding. When I started grad school, my first class was how to do a review of literature, and I was, completely lost and trying to figure out what I wanted to do my project on. And I had Dr. Kara Irwin for my instructor, and she talked about her research because I started grad school in 2010. I think it was. So it was after all of this. I had already had a little experience. I was around for the Make a Splash. And I had heard about the tragic drowning incidents that happened in Memphis, but I was still pretty new to the swimming. I swam my whole life. I don't ever remember a time in my life where I didn't know how to swim. But so I started teaching swimming at that point because I was a graduate assistant. And that's when I was talking with Dr. Irwin. I was like, well, I don't know what to do my research on. And it's like, she's like, what are you passionate about? It's like, well, I've gotten really passionate about teaching swimming because I've never encountered adults who couldn't swim before. It was completely new to me. And the more I got into it and I started doing the research, I decided to do my applied project on practical inquiry to become a better teacher for these students, especially the ones who feared the water, because in my classes, it was usually about maybe 25% who genuinely feared the water and at least half of them who couldn't swim. Now, I taught beginner swimming, but anybody could register for the class, not just even though it was designed for non-swimmers, anybody could register. But I discovered during my time of teaching, every time that when I got out of direct teaching instruction, which was kind of, how everybody learns in the beginning, and started doing more group feedback, peer teaching, and working with all the students. It's been a while. I graduated back in 2012, so it's been a minute since I did my applied project, but I think it made me a better teacher for swimming, because every time I had the class, I had my students write in a journal about their, what they liked about the lesson, what they didn't like, is there anything that you think could be improved? Did you have any setbacks? Any feedback whatsoever that you want to give. And I used those journal entries to improve my teaching, at least anywhere where I could. I mean, there was nothing I could do about the temperature of the water or the hallway going back to the locker room, but there were many times when I was able to take feedback from my students and think, okay, they really like that, I need to do that again. Or, whoa, that was a flop. I'm not going to teach that way again. And it's come a long way, and it's really my passion, and I cannot wait for the natatorium to come in so I can go back to teaching swimming, because I miss it.
Which is a good segue into the natatorium news. And that would be Gabrielle and Rick, if you're still here.
Yeah,
Yes.
I am. I'll mention quickly and then Gabrielle could chime in. So we're extremely fortunate to have a gift from the Rose Foundation, really, that allows us to move forward with this natatorium, which we'll actually be calling the Mike Rose Aquatic Center, as noted here. We've received full approval from the state, and within the next few weeks, actually, they will be starting demolition, and it's slated for about a 12-month project. So we're looking at sometime in the fall of 2022, next year around this time, that this facility should be completed and open. And there are numerous things that we'll be doing inside this facility. Deborah obviously mentioned classes. We have Memphis Tiger swimming. We have swim lessons. We have CPR first aid training that will be going on as well inside this area. So a number of things. We're very fortunate to have this pool, which really complements well. If individuals are on the call and don't know, we just opened the new wellness center on campus, which is just adjacent to the existing rec center, and that opened back in June. Fantastic facility, much larger, much nicer, much more modern, obviously, than the existing facility. So if you haven't taken a look at that, we invite you to do that as well. Gabrielle, you probably want to add some information to what I just said.
Thank you. So I just needed to, Daphne McPherson, I love what you said, like with the natatorium, it is a catalyst for community uplift. And so, this, by the time it is completed, it will be 7 years in the making just for this facility. But what really is the heart of what has gotten me most passionate about the fundraising behind this is what Splash has done. So the natatorium has a much larger story that dates back to 2008 with the founding of Splash and all that is intended with that. And, just need to acknowledge that lots of corporations, foundations came on board to say that this matters, that the University of Memphis can make a difference with outreach to the community and save lives through this facility. And so it is a public and private partnership. And I need to acknowledge Shelby County with a $2 million contribution, recognizing this needs to be a community resource. And it really matters that it's at the University of Memphis. And so, have to be fully transparent that this took a long time because there were a lot of setbacks. It was hard to raise the money and it was just hard to do. And yet there have been many blessings along the way with that through this time, this partnership, the strength of this partnership that is Splash, those core groups that Carol highlighted, that has just grown. And we are looking at we're in a position now where the YMCA has a much stronger relationship with Shelby County Schools as the provider of before and after care. And so what was mentioned is kind of the dream, what is done in UK. My ultimate vision is that Memphis will adopt a model where we are reaching out to school age children, and they indeed have this right and opportunity to learn to swim. And I just, coming back to the statistics and bringing that to life, what Daphne was saying about that community uplift, like it is so important that the facility is what it is. It's a gorgeous state-of-the-art, modern, competitive swimming pool. All right. We're going to host water polo events, regional competitions, swim clinics, and swim lessons there. And people, just imagine families coming in who are scared of the water, unsure, like getting to see their children go through this journey of overcoming their fear and experiencing joy and a sense of like empowerment in the water, and seeing these other activities going on in the same facility. There really is like an inspiration, and the fact that it's at the University of Memphis, where kids and families get to see that there's this whole university and they are making this possible. I just want to commend everyone for coming together, and just I really believe in the vision of what's possible, and it's made possible because of the partners of Splash that started this, who really started this.
Well, let me just say the partners, yes, but your hard work. But I would like to say that we mentioned the top 4 priorities when we started, but then another one is Anthony will attest, along with Jennifer Paris, who was our communication specialist, helping guide the way. One of our goals was to have a pool. So it's like, we just said, you have to dream big and don't worry about anything else along the way. You will get there if that's your mission.
Okay. So we look forward to seeing how the natatorium is grown. I'm amazed at how fast the Wellness Center went and how beautiful it is. I drove by where the Leftwich Tenant Center used to be the other day, and I can't believe how it is just ready to be built. Everything is been bulldozed. So I imagine the natatorium will be as beautiful as this picture, and will end up helping kids save themselves, as well as just in general saving lives. So appreciate that. And any other questions or?
Carol, I just want to say there's something about looking at this amazing photo of the natatorium that just makes me feel so grateful for what Susan and Anthony and you and Dick and Gabrielle have done here, and to carry this through from 2008 on. I'm just in awe of what you guys have done here.
Well, thanks, Andy, but a lot of this probably wouldn't have been possible without you too. So you played a part in this, and we appreciate that. So I kind of look at this whole story as something that I am so glad I was a part of. It really has made my time being a professor at the University of Memphis a fulfilling one, satisfying one. So yeah, I'm looking forward to jumping into that pool myself. So looking forward to it.
And I'll say that it really has changed lives in terms of relationships and families. I remember taking 2 bus loads to the National Black Heritage Championship swim meet of children of all backgrounds from the Memphis Tigers, and many of them are swimming in college now. But I would love to mention what's next and sort of the evolution, where we talked about our original goals, but then when you have new partners that come along, like a person that's on the call, Eddie Walsh, who started a swim team at Grizzlies Prep, but also was instrumental in starting a water polo team that followed the same mission of Splash Mid-South. And so that new blood to expand the opportunities around aquatics above and beyond just competitive swimming. And now it's becoming a workforce development initiative, because there's a lifeguard shortage. So I think it really deals with relevant health, safety, health and wellness issues in terms of childhood obesity, as well as when we talk about workforce development, and teenagers, high schoolers, college students could be their first job that could lead to ultimate careers in aquatics or other related fields. But just so excited about what we will the next chapter of that monograph, where Memphis, the seeds that were planted, over a decade ago, would turn into blossoming trees out of this state-of-the-art aquatic center that will be the fulfillment of our vision, but will have a generational impact.
Great. Well, I appreciate everyone showing up and, ready to go down memory lane and, talk about this very important program. And I look forward to the future of it as well. So thanks for all showing up. And if everyone's done, we're done.
Thank you.
You.
Thank you, everyone.
Job,
See
Dr.
everyone
Irwin.
at the grand opening.
Oh, right. You're all invited.